October's almost over, but we recognize the color pink as the symbol for breast cancer awareness all year long. Early detection is essential in the fight against breast cancer. Take a look.
Thanks, Mary Lou. I'm outside Seattle Cancer Care Alliance in Washington State, where imaging and technology combined with awareness has always been key in the fight against breast cancer. This cancer center's goal every day is to turn cancer patients into cancer survivors. For women, breast cancer is the second leading cause of cancer-related death in the U.S. But death rates are on the decline in what doctors believe to be the result of earlier detection.
Early detection is the most important tool we have in our fight against breast cancer. There's great news for women, which is when breast cancer can be detected early, we can cure it. And that's our goal, and our work is to detect cancer early when it can still be cured.
Imaging technology is especially important when it comes to early detection. And the latest digital mammography can sometimes detect lesions in breasts that may be missed by film images, especially in women under age 50.
There are several benefits to digital mammography. The first is we found that it is better at finding cancers in certain groups of women. Women who are young, women with dense breast tissue, women who have not yet gone through menopause or are going through menopause. So those groups of women actually benefit because we're better at finding their cancers.
Each year, more than 1.2 million people are diagnosed with breast cancer. Dr. Lehman hopes that with early detection, women will be better prepared for early treatment and ultimately full recovery. This month of October is Breast Cancer Awareness Month. Let's continue to spread the word. Back to you in the studio.
GE Healthcare spends over $1 billion a year on breast cancer research and development. And joining me now is the woman who's leading that charge, the Vice President and General Manager of Global X-ray and Mammography at GE Healthcare, Anne LeGrand. Hi, Anne.
Hello, it's fabulous to be here.
Well, it's great to have you, too. This is such an important thing. I mean, pink is everywhere this month. I mean, in fact, my son, my 15-year-old son, Joey, is playing football with pink gloves thanks to the awareness of all the NFL players having pink gloves. So you guys have really done a great job. So what is your role in, making us more aware?
Well, we kind of started 50 years ago. It's pretty amazing. GE was the first company to introduce screening mammography 50 years ago.
Wow, I didn't know you guys started.
Yeah. And then the next big breakthrough was digital mammography. Makes it a little bit easier to diagnose. But what are we doing today? We're going to be doing 25 live pink ribbons around the world. I'll be in Paris. I'll be in front of the Eiffel Tower. Think big pink, very big pink.
Say. No, that reminds me of the movie Funny Face. Think pink, that's where it all started.
Yeah, you're absolutely right.
Yes.
And then we also link with the Susan Komen Foundation as well.
Mm-hmm. And so why was it at the front of GE, strategy?
Well, we ended up announcing that we will be investing an additional $1 billion in cancer research, and it's going to be first about breast cancer.
Oh, so this is your first movement.
Well, we have been investing. We're going to continue to invest, but it's very focused on $1 billion to impact 10 million people on a global basis.
Now, I understand that, we're getting, because of the new imaging, we are seeing breast cancer at the very earliest stages. But just because we're seeing them so early, that doesn't mean, going to radical treatments right away. Doesn't it also mean that you can make lifestyle changes, dietary changes, exercise, things like that, to sort of help, get rid of the cancer? And
well, probably one of the most important things is the real basics. Breast self-exam, because like you said, the earlier the detection, the better the outcome. And in fact, if you get early stage breast cancer, detect it, you have a 95% chance of survival over 5 years. Absolutely critical.
And what exactly is healthymagination? What does that word mean?
Healthymagination, it's the way we talk about cost, quality, and access. And if you think about mammography, it's about getting the appropriate technology to the right place. So whether I'm in Wyoming or Montana, or I am in rural China or Africa, being able to get the equipment to the woman so she can have a mammogram. Very important.
And who should get mammograms?
Well, it's very interesting. First, you have to look at what are your risk factors. How do you determine that? Back to that, know your breast, so that's breast self-exam.
Family history.
Absolutely.
Anyway, thank you so much for being with us.